Hey everyone, welcome to the front row with Ed and Elizabeth. Today we're going to talk about migraine and tension headaches. Oftentimes there are two muscles that are responsible for many common complaints of headaches, and the first one is the sub-occipitalis, which is located at the base of the cranium right through here. The second one is the masseter muscle. So let's first take a closer look at the muscles and also where the referred pain pattern is.
This slide shows both the occipitalis muscle and the sub-occipitalis muscle group. So first let's talk about the occipitalis. As you can see, that's the one that I've highlighted in yellow, and there's a right and a left occipitalis. And then underneath the base of the cranium, there is a whole group of smaller muscles that are collectively known as the sub-occipitalis. The important take-home message here is to understand that your trigger point for your headache could be located at any one of these muscles. And it's important to explore the whole area, literally from the back of the skull all the way down to the base of the cranium and down below onto the first few vertebrae. This is an example of the referred pain pattern for the occipitalis. So where the X is the actual trigger point, but everywhere in red is where we may experience pain. Notice underneath the eye as well can be caused by a trigger point at the back of the cranium. Now we have highlighted the sub-occipitalis group. And as you can tell, there's multiple muscles. No need to worry about what they're called. The take-home message is that you need to take some time to explore this area, as any one of those muscles can be a source of pain. We're now looking at the referred pain pattern for the sub-occipitalis muscle. So once again, where the X's are is the site of pain, but where the red is actually where the pain can be referred to. Once again, all along the side of the head and actually up into the forehead, definitely around the ear and by the eye. The next muscle we're interested in is the masseter muscle, which is basically your chewing muscle. It is a very strong muscle for obvious reasons, and here I have it highlighted in orange. So you can see how it's easily located just underneath the cheekbone and inserts down underneath the jaw. Now take a look at all the areas that it can refer pain. So once again, the black dots indicate where you might be tender, but the red indicates everywhere where you may be experiencing pain that's actually caused by tenderness in the masseter. Make sure you work the masseter and the occipitalis and the occipitalis group if you're having headaches, as these two muscles are very closely linked together.
So as you just saw, the referred pain pattern for the suboccipitals and the masseter can encompass a variety of symptoms in the head, face, jaw pain, tooth pain. Whenever I have patients that have headaches, I always have them try this first because there's not really a downside to it. And I recommend for the base of the cranium, I'm going to show you how to do that one first, the occipitalis muscle. It's great to use two tennis balls taped together. This is just athletic tape, two tennis balls. I do have a link, and I'll put it at the end of this video if you just want to see how I did it. It doesn't have to be pretty, it just has to be functional. So let's talk about how we're going to work the trigger point at the base of the cranium.
Although there are different ways to work the muscles of the cranium and the suboccipitalis group, but I recommend doing it lying down. Now I'm demonstrating on the table as it's a little bit easier for the sake of the video, but if I was actually working on my own trigger points, I would just do this on the floor. The nice thing about two tennis balls taped together is that it forms a little cradle, so your head can kind of sit in between those two tennis balls. Now what I like to do is stabilize the peanut and then move my head around until I find just that special, oh so special spot that might be really sore. Once you find the sore spot after you've explored the area, you want to try to maintain pressure on that area for anywhere from 30 seconds to a minute. You may want to slightly oscillate your head just a little bit if it's a little bit too tender to put direct pressure on that. The key is no more than about a minute per sore spot, and then obviously check the other side as well too. The next muscle I'm going to work while I'm down here is the masseter, and I will also work this muscle while I'm sitting up, but I just wanted to show you that you can also work it when you're lying down. It's easy to find. Find your cheekbone. You can even bite down together and you'll feel that muscle kind of pop out into your fingers. Here I'm using the pads of my fingers and I'm just exploring that area. It's really easy to find and you will find some pretty exquisitely tender points. Now once again, trigger point work should be slightly face cringing, but you should not be in a lot of pain. Each sore spot's going to get worked for 30 seconds to a minute. Refer back to that earlier slide that I showed you in the video if you're wondering exactly where the trigger points might be. You can also use your thumb if you find that to be a little bit easier. I try not to use any tools in this area because it's a pretty sensitive place. Now if you are the overachieving type and you want to work the masseter from inside the mouth, in this example I'm working the left masseter, but I have my right hand and my right thumb on the inside of my mouth, and once again I slowly bite down on the outside of the teeth, of course, until you feel the masseter, and then you're also doing the same thing, but you're getting a little bit of a better massage actually when you're on the inside of the masseter, as well as being able to kind of pinch it from the outside.
So let's quickly summarize what you need to do. First of all, there is a lot you can do for your headaches and jaw pain. Just takes a commitment of time and effort. So get yourself a peanut, 2 tennis balls taped together, work the back of the cranium, see if there's anything that's tender. Remember, each sore spot is 30 seconds to 2 minutes based upon how it feels. Then you're going to get the masseter. You're going to find the cheekbone and work it underneath the masseter just like I showed you there. Then you can also go inside the mouth to get the inside of that masseter. Remember to bite down and you'll feel where that masseter muscle is. You can use your finger pads, you can use your thumbs. I don't really recommend using any sharp tools or anything like that at the base of the cranium or at the jaw just because it's a pretty sensitive area. Now remember, if you're having tightness in the sub-occipital and tenderness there, you got to watch your posture. You got to avoid that forward head posture that so many of us get into. So at the end of this video, I will put another link to some exercises that you can work on to try to improve your posture as well too. One of my specialties is the wall angel. All right, if you have any questions, please leave them down below in the comments. If you like the video, please give it a thumbs up. If you have any suggestions for future videos, let me know. And if you haven't subscribed, please do. Until then, take care.